on. I guess it is on. Welcome, everybody. I'd like to welcome you to the 2022 Respiratory Care Class of 2022 pinning ceremony. I'd like to start with some important introductions. I'm going to start with the respiratory care faculty that is here. First, I have Chaz Burke, our Director of Clinical Education, and I'm going to butcher your last name, I always do it. Stacy and Compson, Patipatak, our clinical instructors. Dustin Bill, and Lewis Rowe. And then we have our Dean, the Dean of Health and Safety Sciences and CTE, Greg Borman. And the President of the college, Mr. Knutson. Mr. Knutson, may we hear from you at this time?
Good morning.
Good morning.
Good morning, everybody. On behalf of the Board of Trustees and the college, welcome to this pinning ceremony. And to the graduates, congratulations.
Thank you.
Remember that commencement is a beginning, not an end. You're just starting on the next phase of your journey. And I know that over the last 2 years, you've been on the front line. Thank you. I know that the 2 years have been very difficult for you and for everybody, but you went a little bit further, not only in maintaining your studies, but in helping fight the virus in the hospitals and on the front line, and we all owe you a thank you for that. You have chosen a profession of service. There is honor in that. Always remember that to be of service means that you subordinate your own needs to meet the needs of others. You can be very, very proud of that and the work that you have done. So on behalf of the college, congratulations. Enjoy this milestone, and I hope I never see you professionally.
Thank you.
What a journey it has been for you guys. This class started with COVID, and they have had online classes, in-person and clinical classes, last-minute changes in their schedules, but they have all made it through. They are a group of non-quitters. So what is a respiratory therapist? We've heard a lot about respiratory therapists, especially with this pandemic. So when someone asks me what a respiratory therapist is, I won't tell them I'm a snot jockey. I won't say that I'm the queen of mucus. I won't say that I work at a hospital. I won't say that I'm like an RN. This is what I say. I make people better. I give smiles to the elderly. I make runs to the ER to intubate a patient with a gunshot wound. I hold the nebulizer of a child who cannot breathe because of asthma. I hold the hand of a dying man whose years of smoking have caught up with him. I hold the hand of a dying woman who got COVID and her family cannot be with her. I push down on the chest of a cardiac arrest victim and urge him back to life with a combination of hard work, sweat, clinical knowledge, and prayer. I monitor life support equipment. I have my ACLS credentials because sometimes in my hospital I am 911. I work in a place where patients have diseases that could kill me, and I face that threat willingly every day because there is no reward without risk. And as a scientist, I face that risk willingly. I make life and death decisions every day. I calculate drug doses, do cardiac outputs, and most importantly, I listen to patients. I resuscitate babies born with meconium in their lungs. I take 2 minutes to myself to brush away the tears after we lose yet another COVID patient, as my phone sends me to yet another emergency. I deal with every bodily secretion from every orifice. I am the extra set of hands the nurses can't live without, not because I'm a warm body, but because I care and they know it. I make scared patients laugh. I put up with irate patients, irate bosses, There are never enough ink pens or 15-millimeter adapters, and half the time the tubing doesn't fit. Equipment sometimes doesn't work, and you can count on the fact that some other professional has stolen my stethoscope when I need it the most. I replace empty oxygen cylinders, put up with Sidex fumes, elevators too small for patients' beds, adhesive tape that isn't, gloves that don't fit, bad coffee, phones that go off at lunch, and half-eaten meals in the cafeteria. I have to document everything I do. I get called in for in-service education on my days off. I get coughed on, sneezed on, bled on, spit on, puked on, and frequently have people show me what they coughed up as if it was a work of art. And no, I wouldn't trade places with any other professional for all the gold in Fort Knox because I love what I do. I stay for an extra 8-hour shift to cover for a sick colleague because my patients matter to me and someone has to do it. I spend more waking hours with sick people than I do my own family. I get called in when there's an emergency. It's the life I choose. It's my choice. I save lives and I alleviate suffering every day. And you want to know what I make? Here's what I make. I make a difference. I am proud of each of you for joining that field with me, and I am proud to now call you my colleagues. At this time, I'd like to hear from the Dean of Health and Safety Science.
Kind of tough to follow that when you're a little misty after hearing all that. Whew. Whew. Give me a second. I'm tied to some of that, by the way, with family members. Nevertheless, congratulations. I've been in with you. I've seen what you've done. I've been in the hospitals. The amount of respect I have for what you have gone through, and will go through is immense. To the family and supporters, for everybody who's here, thank you for supporting them. Thank you for being here. Thank you for being a part of what we do. Thank you.
I think the moment they are waiting for is ready to come. Are you ready for your pens? Yeah. Have that mic. Want to go up there with that mic?
Yes. All right, you guys. The pins, the completion. First one up, Crystal Donna Augustine. Crystal Alvarez. You okay? Brittany Dowdell. Rachel Doyle.
Oh, thank you. I never quit it, y'all. I never quit.
Alicia Green. Leo Jovel Garcia. Laura Martinez. Junior Mayorga Espinal. Tiffany Smith. Brooke Stogel. Javier Tamayo. Stephanie Young. Thank you all for coming today. A little closing remarks. Perseverance got you guys here. How's it feel? Great. You did it. You did it. An author and a poet once said, "Fortune favors the bold." You guys have passed the school. Now you got to get your exams scheduled. We have lots of openings at both hospitals. We need fellow co-workers. You're my colleagues now, no longer students. Some of them have already scheduled their exam, I hear, on Monday. Congratulations. Get it done. Thank you all for coming out today to be with them on their very special day. They're about to start a new life, a new career. One door is closed. The next one is about to open. You guys have been an awesome class. Congratulations.
Thank you.
Join us in the back for some refreshments. You can all join us in the back for some refreshments. Have a good day.